Hello, everybody. Sorry for the couple of minutes of delay. We were waiting for some of our panelists to join, and in this new world, there could be tech troubles. I mean, no traffic problems, but tech troubles. Tech is the new traffic. The topic today is back to school in 2020. The fact that we have to even discuss it, talks about what a strange time we live in. I would have liked to call the topic back to physical school in 2020 because in my mind, schools are already open virtually. But like I said, these are times when we have to even discuss whether it's safe for schools to open and for us to let, kids back in the building. Just to start this discussion with a little nugget, I hope, I'm clear and everyone can hear me. So just to start this, like I said, with a little nugget, Michael Young, who was, who worked for the US government, and he had actually helped draft the entire unification of East and West Germany. It was at that time a massive task, and right now he works for a university in Texas. In fact, he said that drafting a back-to-school plan is harder than even planning the unification of Germany. So that just tells us the scale of, what we are about to discuss. Schools, shut before everything. I remember it was the 14th of March, and we were told that schools are to be shut. At that time, we were figuring out, maybe we'll be shut for a week, 2 weeks. I remember clearly thinking at that time that it's, it's China's problem, other countries, it was somebody else's problem, not ours, till it, reached us. And we know we are, in the thick of it right now. So I remember when we sent out that email to schools. Minnie is a school parent, so she knows that we said, we're shutting the school 1 day earlier for spring break because of the coronavirus. We never thought we would be shut for 6 months. So we actually went into it, overnight. Schools were asked to reinvent. We've been talking about, going online for a long time, but this pretty much was a scramble. We all had a plan to shut schools. No one at that time thought, how the hell are we going to reopen? So that's, going to be the driving point of this discussion today. So schools will eventually need to reopen. Keeping schools closed comes with massive societal costs, individual costs. There are many children who, cannot effectively learn. They cannot socialize. Some of them can't even get a meal like we do in public schools, or engage, be active, or get any kind of support. So the eventuality is that schools will have to open, and not just because children can come back to schools, but also parents and caregivers can go back to work. We often forget that element that parents are at home right now because their kids are at home. I think the other thing that is very stark right now is really India's digital divide. Nearly 4% of our rural household have access to computers, and 14% have access to the internet. The government, the NGO, many NGOs, other public-private partnerships and organizations are trying to, bridge or close this gap. But, we know it's a tall order. So it's also about getting kids in, other parts of India back to school, not only from a learning point of view, but from really the fact that they just from an infrastructure and an access point of view. But, as a disclaimer, I would, like to mention at the beginning of this talk that, all of us here work in the private sector. A lot of the stuff that is happening in the grassroots level, in public schools, in rural areas is really, it comes within the public policy domain. So if we do not discuss it, it's not really a bias, but it's really because we just want to put things in our own personal context. So, apologies for that, but I did want to give a context to that, we do understand, what is happening in, rural and other parts of India where kids, why only other parts of India, even within our own city, where kids don't have the kind of digital access that is really a prerequisite now for online learning. So just to set the context, given our own experiences, not really our expertise, but more our experiences, this talk will be more urban centric, more private school centric. So just to lay that down. So we know schools will open. We don't know when, but we know eventually they will open. I think the doctors on this panel, will agree with me that we're not looking at zero cases, but we're looking at really a minimal risk strategy. And it's important to think of them as two different things. None of us can open schools thinking that there will be zero cases, but we do want to open schools with the environment that people feel safe and they feel that risk has been reduced. Risk can never be eliminated. I mean, it's not eliminated. It wasn't eliminated in our lives, even pre-COVID. So in these times, there's no way that risk can be totally eliminated. But we're all trying our best to make sure that risk will be reduced. Having put that context, and so you get to know the panelists and their perspectives better, let me introduce them. I'd like to introduce Dr. Tanu Singhal. She's a practicing pediatrician and a leading infectious disease specialist, a COVID warrior, an infectious disease specialist and pediatrician by training. Okay, sorry. I hope the chat is active again. Okay, all right. Sorry. She has been at the tip of the spear since the beginning of the battle against COVID-19. She brings a frontline physician's invaluable perspective with a pediatrician's backdrop to help guide schools and institutions with their back-to-school approach. What I loved about you, possibly you've read her, introduction online, but what the lines that struck out to me were the ever cheerful and articulate. Dr. Singhal, I have heard her on a previous panel and I can vouch for that. So thank you, Doctor.
Yeah, thank you. And I'm also a mother of 2 school-going kids. So I will bring a mother's perspective as well.
Yeah, that's much needed. It's the 360 stakeholder perspective that we require right now. Yeah. The second panelist I'd like to introduction is Mr. Rustam Kerawala. He is an edupreneur and chairman of Vibgyor Group of Schools. They have 39 campuses pan India. And Mr. Kerawala understands the pulse of this country. He has been closely involved in creating physical spaces for a holistic education. It'll be interesting, especially to hear his perspectives, from the point of view of school management, teachers, and I'm sure he and his team are already thinking of creative solutions to bring kids back to campus. So welcome, Mr. Kerawala.
Good evening, everybody.
Good evening. The next panelist is someone I know, Miss Mary Mathur. Many of you already know her. She's a television host, actor, model, a proud mother of 2. Minnie is very articulate. I know that in both in her as a mom in school and in various platforms that she has an access to. So I think it'd be very interesting to get the perspective of a parent. A simple question such as, would you be comfortable sending your kids back to school? That could be something that I'm sure we'll definitely come back to. Dr. Anupa Dixit is the lab director at Suburban Diagnostics. I've gotten to know over the last week because we got our son tested at Suburban before he flew back to the United States for his degree. And she was very helpful. So this is public thanks to you, Dr. Dixit. She has 17 years of experience in diagnostics and really has been at the helm of COVID-19 testing since March 2020. In fact, before we went online, I asked her how many tests does the lab, do the labs conduct a day? And she said 3,000, which is possibly the largest that a private sector lab is doing. Fantastic. She, in fact, has many insights on testing and different protocols. So even her perspective on how safe it is to open schools, or generally what kind of risk assessment should schools do before they open, will be invaluable. So again, welcome. We have one more panelist who's will possibly sign on during the course of the discussion. So I do want to introduce her. You've possibly seen her in the sign-ups as well. Dr. Anjali Chhabria. She really needs no introduction. I mean, she's always the go-to person in so many different cases where a psychiatrist's perspective is required. I think her expertise in child psychology, what kids are feeling at the moment, whether they'll be able to come back to school, would have been interesting. She is going to try, to join us. I guess, sometimes work and life has come in the way. So, let's hang on and wait for her. But while we're waiting for her, we can, start this discussion. A little bit about me. I've been in the field of education for 20 years. I started, teaching in colleges, moved to international schools. Currently, I work with the overall international school. I've been there for 10 years. I have 2 grown-up kids. My daughter is a teacher, and my son is pursuing his engineering, like I said, in the US. This is also a good day to give a shout out to, all teachers. Whether in classrooms or in life, many of you are life teachers. So happy Teachers Day to everybody.
Everyone watching.
Yeah. So Dr. Sanjay has contacted me to moderate this webinar. Dr. Sanjay and Anju, I've known them for years. I've seen them, build their enterprise. My joke with Sanjay is that, you built this business on our blood and your sweat and tears. So I hope Dr. Sanjay is listening in and, realizing the entire significance of taking our blood. Okay, I think Anjali is Dr. Anjali is just signing in. I can see her.
Yeah, here she is.
Hello, Dr. Chhabria.
Am I heard? Am I audible?
Yes. Yes, you are.
Yes, you are. Welcome. Yeah.
Okay.
Okay. I just introduced you, Anjali. I just have introduced you to our listeners. We have about a good many right now. Many of them enthusiastically had even logged in before the webinar started. Okay. Let's start with, really looking at the entire reason why we are looking at opening schools. A simple question, I think the starting point is we were, in person, we went online. Online is on right now. We can really start with how effective it is. What are your own experiences as parents? And, I'd like to direct the question first to Mr. Kerawala. What is it that you hear? What is your, opinion about this?
Take your phone.
So I think from school's perspective, one needs to firstly differentiate between the different age groups, because pre-primary, primary, and secondary, all of them have a different requirement. So that's one part of it. The second part of it is, I think, as far as education is concerned. So when you're talking about pure academics, then online does manage to serve to a large extent. But a school is far more than just academics. There's a lot of other developmental skills, social skills, there's the other activities that happen So I think that exposure is something, and that experience is something that the children are missing out on. So yeah, so if you ask me, I think from a secondary student perspective, I think the academics are moving quite well. Pre-primary and primary, there is a lot of involvement of the parents.
Right.
That they would have, a lot of them are working parents, so that really becomes an additional burden, and that's one of the things that the schools also take care of. That they take care of the child, where the parents can get involved with their professional work, which again is compromised at this point of time. So, yeah. So next thing, and there is definitely a lot of additional burden on the parents. I think that's where we stand today. From a future perspective, I think it is uncertain. I don't think even the government really have that kind of clarity, and fairly so. It's right now a wait and watch, and yeah, I guess that's what we can say.
That's true. I mean, the government latest guideline is that September 21st, in non-containment areas or in safe areas, secondary kids from grade 9 to 12 can, go into school to solve difficulties with prior appointments, and I guess just to engage with the teachers. Some states in India have, kind of, are considering it. Of course, the government of Maharashtra has said that, schools will be shut till September 30th. But it's interesting to see actually what is happening even around the world. I have some data in terms of in the United States, 3/4 of the largest school districts are continuing remotely. Kenya has said that schools will stay closed till 2021. And in the Philippines, this was early news that they said they are going to actually keep schools closed till a vaccine becomes available. In Netherlands, in parts of Europe, schools are going in person. They're expecting all kids to be in the classroom. In some, there is a hybrid model. It's really interesting. So I do agree with you, Mr. Kerawala, that it's important to look at the age groups, differently. In fact, hello? Yeah.
There's a little furry friend who also wants to add to your bit.
It's always interesting to have an additional panelist.
Into account.
In fact, Dr. Tanu was telling me before we started that her daughter's in grade 9, and she said, "Mom, please say yes, school should open." So this is really the secondary perspective. But Mr. Kerawala is right when he says that, there is, of course, no one size fits all. We have to look at the school, we have to look at the context, we have to look at the age group of kids. And even from what I've heard, for the secondary students, it's not the same, but at least the focus on curriculum and, the subject is on. I think the challenge really lies for both primary and, pre-primary kids. We went from an era when we said there's no screen time, and now we're encouraging them to sit in front of screens and tablets, supervised by, adults in the room. So this actually leads, well into my next question with, Dr. Anjali Chhabria. Anju, what have you been hearing about, have parents been coming to you with anxious children? Hello?
Can't hear you.
Now.
Yeah.
Yes, okay.
Yeah, sorry.
First of all, I'm sorry I'm late. I had to change 3 phones, 2 iPads, and I've actually jumped into someone else's laptop, and that's why the furry friend was around. So, and I'm sure this is happening in everybody's classrooms as well. When we
Right.
have all this happening, some of the things that the students are telling me, the teachers tell me that they're so upset to see students sprawled on bed, and they're happy to see the mothers walking around in shorts. So, so coming to the reactions that we have seen, so I have clearly seen two types of reactions. One is happy kids, because they're happier to be around their parents, they're happier to be at home, okay, and they're happy to spend so much time with each other. And of course, the other side is that right now, some kids who were happy earlier are suddenly getting anxious, are getting panic attacks, are getting aggressive, are having discipline issues, you know. And of course, from the parents' point of view, for the parents are getting tired because they're trying to tackle their own work, they're trying to tackle kids, and they're also getting into wars because some homework was to be submitted, and one child submitted it, the other one did not submit it. So lots of things are happening. Okay, and as I'm talking to you, I have seen two children today. One with panic attacks, and the other one who is feeling that she is missing the socializing part of it. Because learning is happening, but a lot of screen time is being spent. So she actually said, by evening I start getting depressive. She says, I have tuition till whatever 2 o'clock, and then I have 3 to 5 I have extra classes, and 5 o'clock I feel so depressive. And honestly, what was my solution to it? I told the mother, please switch off all computers, switch off all gadgets, and go out and play, run, cycle, do what you have to. So the child said, but I'm doing online exercise. I said, that's exactly what I don't want to do. I don't want you to do online exercise. I want you to go down and play football, cycle, do what you have to. And here we are only talking about urban kids. My worry is what is happening with all the villages in our country. Because even if we give them the laptops, where are they going to sit? They are in houses where there are 10 people.
Right.
If we are having difficulties negotiating space in our houses, you can just imagine what must be happening to them. Some of the teenagers there tell me that they have reversed their sleep cycle just because they don't want to be amongst all those people. So they sleep in the day and they sit up at night, either they study or they interact with their friends or whatever they need to do, just to get some privacy. So I'm sure this is just the tip of the iceberg.
Yeah. In fact, I would have typically taken questions towards the end, but a question's already come for you, Dr. Chhabria, and what you just said really leads well into it. It's a question from one of our participants, which says, my child during lockdown is throwing a lot of tantrums. How to overcome it?
Right. So I don't know whether this is a mom or a dad, but whoever's asking the question, I would say that if you had 75%, if on the patient scale, if you were 7 on 10, this is the time to be 9.5. Okay, because kids are getting restless. All the kids I have met so far are saying that they're not able to pay attention. And I know a lot of us also, we may be doing our tasks, but at the beginning of the lockdown, even to read a book was difficult. So kids are getting quite restless, and because of that, they do not know how to expend their energy, and because of that, they are getting aggressive. So to all the parents who are watching this, the first thing is that yes, we have to discipline our kids. So far our teachers were helping us, but sorry guys, you have to do it now. And you have to come up with newer creative ways to do that. Okay, the child is going to push limits. I've had people get into war zones because I want to watch the iPad for 1.5 hours and my mother tells me 45 minutes. But we have to be calm and nice, and we have to be smiling through it all. Because if we are getting anxious because of all the 100 reasons, whether it's financial, whether it's work, whatever the reasons are, whether it's space constraints, that is happening to kids multiplied by 100. So I think patience, and if you feel you're not able to handle it, there are lots of online psychologists. You can just tune into them. Some of them even don't charge. So get a free session for yourself and get some help, because aggression in kids can be the first sign of an emotional disturbance. So we need to be cognizant to that. However, see if your child is sleeping properly. I had a 10-year-old the other day who said, I'm not sleeping, and mama doesn't even come to know I sleep at 3 o'clock in the morning. Okay, so whether they're sleeping properly, whether they're eating properly, and most important, ensure that they're playing. Physical exercise, nothing can supplement that.
Thank you for that. Minnie, your kids have been at, learning from home since the last, couple of weeks. It's coming up to a month. What has your experience been as a parent?
So Ashita, I'm one of those few people who had a fairly positive transition from offline to online education for my kids. I have a 17-year-old and a 12-year-old, and initially, I think it took a while getting used to the fact that, oh my God, you can't be seen behind me, and, finding their own spots. And, here we were encouraging them to not use screen time beyond a certain time. And here, like Dr. Chabra, rightly said, we are actually encouraging them to, face the screen. But for me, the transition has been fairly easy. But it's been a complete change, a shift of lifestyle for us as parents as well, because we did recognize that this could go on for longer, and therefore what we did as a family, we did something. I'm just going to share my experience, because we decided to give them what they were missing when they were offline. All of us were working, we're all busy professionals, we didn't get time to chat up with them and speak with them as much as we should. So we spent a lot of time together in lockdown. Actually made meal times very important for all of us on the table. So no devices. We are all, leave our computers behind. We actually talk about, our school days and our grandparents and their love stories and what happened with Gandhiji. And we've been making sure that we see a valid, a good film a week, which is non-negotiable together. We would do family workouts. Okay, so all this was working fine for about 4 months. But lately, my younger one is now showing signs of getting really exhausted. Not because of the socializing factor, because I let them do their Netflix parties once a week, and I let them do their little video calling with each other, because I feel social interaction is very important, and they have been communicating. My worry has been that the smaller one is now saying, okay, so how long? Now she's getting impatient. The older one is focused. He knows that now this is my last run up to college and I have to get this done. He's in fact been the most productive he's ever been. But my smaller one was showing signs of distress. So we actually did a very radical thing. And of course, what I'm saying is full of privilege, and we're lucky that we are the few percentage of urban parents who can afford to do what we did. We relocated. We left home, and we took our dog and put it in the car, and we went for a road trip. We took 2 days off school, and then we relocated. And now just the change of scene settled down everything that was a problem with them. And we're still doing online school, but there's just a different, there's a little bit of change by the end of it. So we are doing everything, we're keeping everything malleable. Everything is on a day-to-day basis. And I can understand many kids feeling anxious about it. But we're kind of having to be on our feet all the time as parents.
Yeah, I think you made a good point. I know as an educator, I often hear parents, worrying about that, so many topics are not covered, or my kid is going to fall behind.
This is not the time, Ashita.
This is not the time.
Exactly. About that. We're going through a really big, once in a lifetime scare. And I think sticking to curriculum and this portion has not been covered, or oh my God, I missed 2 days of school, should not really be. In fact, I would like to request schools to just be a little easier about this. Kids who are not being able to cope or not being able to learn should be given that time out, and it should be to each one his own. You cannot be running the discipline of a regular school. Sorry to cut you
No, you're absolutely right.
It has to be customized to the child. You can't have one size fits all in online education at all.
No, I couldn't agree more. In fact, what you said is really music to my ears, because it's really not about curriculum, content, subjects. Forget the learning gap. I think there's a huge skills gap, within our kids that we've had a fantastic opportunity, to fill. Again, you mentioned privilege. So I'm again going to, for those who, turned in late, I do want to again talk about the digital divide in India. We do recognize that, a lot of our discussion today is going to be urban centric, private school centric. So like I said, I apologize for that, not as from a bias point of view, but really from a context point of view. So I just, thought it makes sense to say it one more time. But even if you look at all the different sides, whether it's working for secondary kids, whether it's, not working for primary kids, for little children, we're plonking them in, in front of a screen. The eventuality is that, schools are going to open. So my question is really to, both the doctors in this panel. The first is a very broad question. It's like, what I said about the Philippines. It's an entire government who has decided that we won't open schools before there is a vaccine. What do you think is that the right reasoning? Is that really the way to look at it? Any of you can start. Yeah.
Yeah. So, you know what? Whenever we take a decision, we look at the risks versus the benefits. Okay. So we are talking only from a private school perspective, and we are saying that the benefits of opening the school will be that children will have less psychiatric problems, they might mingle well, they will socialize, they will learn other skills. But then we also have to look at the risks associated with it. The risk is of infection. Like you said, that there is definitely, when you step out of the house, your risk of acquiring COVID goes up. And not only COVID, but other illnesses as well. And while we can draw comfort from the fact that children don't get severe COVID, but they are going to kind of come back to their homes. And another important way by which we in India and Mumbai are different from Western countries are that there are not many elderly people staying in homes, because many of them are in nursing homes or others, whereas many places they are joint families. So you have the grandparents. So that way the risk of transmission to them is high. So the risk is of the children themselves falling sick. The risk is of the children transmitting the infection to their grandparents. And the third risk is the support staff in the school and the teachers, who are also at risk of contracting infections. So the way things are right now in our country and in Mumbai, I don't think this is the right time to open, because I feel that the risks are much higher than the possible benefits. And the question is that how long, and the answer would be we don't know. Because, we also have to see whether our healthcare system is, is tuned to managing extra number of cases. So, we were in Mumbai having 1,000 cases per day. And we were thinking that now we are on the decline, and following the Ganpati festival, we now have about 2,000 cases per day in Mumbai. And every day there is a rush for getting beds into hospitals. So we have to somehow flatten the curve. And we know that whenever we have increased mixing, the number of infections goes up. So I think at this point in time, I would say the risks of opening school would outrun the benefits.
Okay.
So what I can add to this is, agreed that we are grappling with uncertainties, but we are in a position where we need to weigh two bad options with us. One is to isolate children and educate them digitally. Second is either put them on risk, send them to school and see what is going to happen. Now, we all know that there is no way we can guarantee a zero risk of disease transmission while they are at school. But keeping children away from school as well do not guarantee safety from the disease. That is one thing we need to understand, because the family members are going out, they're working. What is the guarantee on that? They're eventually coming back home and the children are getting exposed to that, though they're always at risk. So it's a very difficult situation to balance, but I agree with Dr. Tanu. As of now, as of today, yes, we are not in a position that our schools open. Government has already given us a month's time. We should evaluate, see by the end of the September how the situation is. And yes, meticulous planning, and a lot depends on the schools, how strictly they are able to implement all the safety protocols. I think that is the most essential part here, where schools will play a very important role when it comes to the protocol and the training and making sure that there is a distancing, social distancing, and all the behavioral things are taken care of when we open eventually. But as of now, agreed, we are not in a position to open the schools. Maybe not after a month as well, but we need to be waiting for this very soon to open. Eventually, it has to open someday or the other.
Ashita, can I just bung in with a point just to,
Please do.
I just feel that, we have to look at this in a larger perspective, to just pull out and see what we're dealing with here. Okay, instead of going like the entire handling of our pandemic has been 15 minutes, 15-day modules. The point is, it is going to take its own time to go away. This is not going away with the second that the vaccine gets approved.
Right.
So we are in for the long haul. But look at where we are in the chart, and the doctors will agree with me. We are still on rising cases. This is the time we should be locking down. This is not the time that we should be opening schools and as parents, as students, in the field of education, and Ashta will tell me, there have been gap years. People take gap years all the time, where they figure what they want to do and then they continue it. It won't destroy their entire education process if you keep them safe. Point number 2. Kids staying home and adults going out is very different from kids going out and coming back to join families. You can control. Adults are in a much better position to understand health risks and practice them so as not to give the infection to people at home. How do you control kids? How many safeguards can you put in place? I have myself been on set. Okay, very, very. I took a very calculated decision to go on shoot for 4 days, and I can tell you, however many SOPs you put in place and however many rules and sanitization tunnels and thermometers you put in, you cannot idiot-proof a workplace. You cannot. And with children, we are giving them too much responsibility. If we tell them, okay, we are sending you, but you know what? Can't do this, can't do that, can't do that. You're going to scar them for life in terms of how they react to other children. As it is, people are feeling so much hostility. You look at every ambulatory object as possible COVID infection. You don't want that to be the reality for children when they meet other children. You still want them to know that when we meet, we are going to hug. I don't want that for my children, where they view other children as just possible suspects.
So I want to share something here.
So Dr. Anjali, I hope that's what Minnie said about scarred for life.
Right.
So I would like you to really comment on what she said. I mean, how is it going to affect our kids?
So I'll tell you something before this. So recently I had a bunch of kids, okay, and I had a Zoom meeting with them because they were getting upset with their parents because parents forget school. They don't want to go back to school. They're learning at home, but they want to go and play cricket. Okay. So, and the parents, and these are a group of adolescents. Okay. So I actually had a Zoom meeting with them. And I asked them, I said, okay, so you know what is happening. So we discussed COVID, we discussed everything about COVID. And I asked them, how are you going to play cricket? And the solutions, the creativity that came up with kids was fantastic. So I think what we need to do is also make them a part of our conversation.
Absolutely.
And the kids actually said that, okay, if I have to bowl, earlier I used to wipe, I used to apply spit to the ball, and I'm not going to do that. Okay, and I'm going to carry a sanitizer with me, I'm going to carry a napkin with me. But how are we going to maintain the social distancing? Okay, and we had a discussion about this. Now, when kids become partners in solutions, okay, that is when we are making them think. So as far as scarring them, I think it is how the adults around the kids are that makes a lot of difference. Okay, if adults around them are anxious, the kid is going to pick up anxiety. Okay, but if the adults around them say that, okay, let's play this like a game, I remember the movie about
Life is beautiful.
Yes, life is beautiful. There was an entire war going on and they're playing a game. So I think this is how we need to come up with solutions. Of course, we also need to think about, yes, we can take a gap year mini, but there are these NEET exams and IIT-G exams and all that. And
I didn't mean a gap year like
Yeah.
actually take a gap year, but if we have a year that is educationally not on point,
Absolutely.
we should be okay with it.
Absolutely. So somewhere I was reading about that this year should be only be about teaching essentials and life skills.
Yes.
So whether the child is mopping, dusting, cooking, watering plants, these are also skills that we need them to learn. But of course, the onus then comes back to the houses, to the parents, and my worry is also about the emotional. What a good teacher, and first of all, a very happy Teachers' Day to all the teachers here. A good teacher, if we all remember, our best teacher was not someone who taught us, but someone who picked up on our emotions. And that is what I feel bad about. That there are children who are sitting, there's one kid sitting with two parents who want to kill each other. And that kid really wants to run away from home, but he has to sit there and be the judge between both his parents. So, I don't know how we are going to, bear that gap as to whether, I don't know what the experiences about online teachings are, and I would ask the teachers here to comment, whether have we been able to pick up emotional issues online?
From whatever the feedback we've heard is that's possibly the hardest part of the job right now, to have that emotional connection. And even for the students, peer-to-peer learning is so important. That's another vital element that is missing. And that's why this entire discussion about whether we know, I think all of us can say that there's really not going to be the right time. There's not going to be that one single day when we say that yes, it's safe to send kids back to school. Many of them could be even infrastructure restrictions. So my next question is to you, Mr. Kerawala. With your pan India presence, 39 campuses, but are you doing anything to gear up for a day when kids will be back in school? I know I've been on a couple of panels where they've spoken about de-densifying our schools. Not having the number of the kids that are in the building on a normal day. What are the adjustments in infrastructure that schools will have to do to get kids back in school?
Sorry, I'm not sure if you can hear me to start with.
We can hear you.
Okay, because my screen is stuck.
I hope you could hear the question.
Yeah, I heard the question.
Super. Yeah.
Okay. So, honestly speaking, we know that there is a lot that is going to be needed to be done. And we also understand that it's quite a long way off. Because irrespective of whether the school wants to open or not, or what the government has to say, I think the parents and the survey that we had done with the parents was very clear that they were not keen on sending their kids to school until there is a definite vaccine or a solution to this. So, if you ask me, I don't think the schools are going to be opening for this entire academic session. Even if they do, it's not that the parents are going to be sending their kids. There are challenges, and I think something that
Can't hear you. Can you talk a little louder, please?
Yeah, so from a survey done with the parents, they were quite clear that they were not anxious to send their children to the school until there was a vaccine or until this pandemic had some definite conclusion. So whether we open the schools or not, I don't think there's going to be too many people coming in. How we are going to open, how we are going to prepare to open is a long way off. And I guess it's at that point and the circumstances at that point and whatever is available that will decide that. All the information available in public domain with respect to sanitizers and social distancing or physical distancing and all the precautions I don't know how much of that is actually doable in the environment of a school. While we can do it, or how much of it will actually be effective in that environment, even if we reduce the class size to half and have it on every other alternate day, I think it will still be a handful. I don't think it will have the kind of effect to, nullify this entire pandemic. I think it's far bigger than we can handle from the kind of precautions that we can make. So it's a wait and watch game for now, I guess.
Yeah. I think it's a wait and watch game, and I think even when schools open, they will have to have a huge amount of flexibility. It's about having some kids in the building, some kids not. There's not going to be a time when you can have 2,000 children and teachers in the building at the same time. It could be staggered hours. It could be a hybrid model. I agree with you, Mr. Kerawala. It's going to be a personal choice. There could be some parents who are comfortable sending their kids to school, some who are not. So I know there are schools and colleges around the world who are already starting with a hybrid model. That's one. The second is really being able to flip from, starting, stopping, starting again. I heard of a school in Singapore that had started. It was 2 weeks into regular in-person classes. A plumber on the campus got COVID, and they shut the school campus for 2 weeks. So, I don't think. I think we've all been the most open-minded and flexible we have ever been. But for schools, it's especially challenging.
Right.
Even for schools that have opened, a huge element has been the testing protocols. In fact, right at the beginning, I spoke about how Dr. Dixit helped us with, the testing of our son before he went back to the United States. He's on a campus in the US where it's compulsory to get tested bi-weekly. That's a huge amount of resources various colleges putting behind. They've devised an app which tracks whether the kids have been are testing. So a lot of schools and colleges that are opening around the world are banking a lot on testing protocols. What are your thoughts on that, really? Yeah, Dr. Kanu, what would you say?
While testing helps, but it is not error-proof, because if you understand, you get, let's say, exposed to the virus, then any time between 2 to 14 days, you can get symptoms. And many people may not get symptoms whatsoever. And the test which you do picks up the virus only 50 to 60% of the times. So if you have tested someone today and that person is negative, this validity is not there. Like, you'll be fine for the next 7 days. You could become positive any day. And there is a lag behind testing and getting the report. So basically, while it gives you some kind of mental satisfaction, in the real world, it is not very useful. So that is why the best strategy is symptom and contact based strategy, where you have people who come into your organization, whether it is a school or an office, are asked for presence of symptoms or contact with a possible case and asked not to come if they have that. That works better than regular testing, because regular testing is very resource intensive and may not really help in the long run. And we must also understand that tests are limited, okay, even now. So you would want to use the testing for, testing symptomatic people so that they don't have to wait. So if a lot of tests are done just for routine screening, then obviously people who are diseased would suffer, isn't it? So we have to direct our resources to where they are most needed. So that is why I feel that even when schools open, and there is this thing about screening children and all, it should be more on the basis of symptoms and contact rather than on the basis of the test.
I have another question, Ashita. What happens medico-legally? What if I have a kid who develops COVID, and I say, oh, the kid came to school and that's where he got COVID? How would you ever prove or disprove that? because sometimes just getting, someone may really fall sick and get into a hospital, and we've seen, all of us who are working with COVID here are seeing even 20-year-olds, go down very badly. So, I mean, I don't know, that also would be a question to the educators here.
Yeah.
I mean, are we going to think about insurance there, or, what are the steps that we are going to be taking from
That's
that
true.
point of view,
That actually Mr. Kerawala can also help me answer this question in terms of, is there any liability on boards if somebody contracts COVID within the school premises?
I don't think there could be any liability. Well, I'm not the expert on the legal, but I don't think there could be any specific liability. And there's really nothing else that we can do. I mean, with all the precautions that can be taken, let's assume children. Teachers coming in, there are ancillary workers coming in, children are traveling by bus, the transport, the auto, the bus drivers. They come from areas, societies where there is far more, the pandemic is far more widespread. And how do you really, I mean, there's absolutely no way to bring that kind of control or even to put a probability on control. And finally, it takes this one person to be able to spread that. And as we all know, it could be asymptomatic, and any of us could be having it and be spreading it with all the people that we interact with. So I don't think at this point of time, in fact, as far as the pandemic is concerned, I think the best of the brains and the scientists also are grappling with the situation. I don't think they themselves really know what, how, where. So when that is the situation, how do you expect any kind of liability to be evolved or put onto anybody when it's not identified?
Right. And I guess this question would even be relevant to any organization that is, asking people to come into work. It could be the airline industry, the hospitality industry. I think whatever legal reading I have, done on this matter, as long as you have all the safety protocols in place, you've done your own risk assessment. For example, at our school, our non-teaching staff has started coming to the campus. And even before they come in, there's a thorough risk assessment. And, I agree with Dr. Tanu, it's more symptom-based screening rather than asking them to give us, a COVID negative certificate, because we all know that is, kind of, limited in terms of how reliable it is, especially over a longer period of time. So, I mean, I encourage, the listeners to send in their questions. I'm also going to set up a online poll, simple poll. Do you think schools should
Ashita,
open?
I just want to add one or two things
Please
here.
Please do.
One is there are certain countries which are telling the kids to test themselves. Like UK, a child is supposed to do a RT-PCR himself or herself. Now, our doctors will tell you here that if you want an actual RT-PCR, it is painful. Now, I don't even know how these kids are, doing their test themselves and sending it.
Right.
So that is one. And the second thing is, still the vaccine comes in. I think what we need to look for is what we call is the social vaccine. And children remember SMS very easily. Okay, S for social distancing, M for masks, and S for sanitizers. So this is something like how Japan has started, just maintaining. Of course, Japan always did it. They maintained their distance, they did all these things, but I think the entire, first of all, we'll have to all educate ourselves or re-educate ourselves with the entire culture, So I think whenever we start, I was actually thinking today, I don't know whether we'll be able to hug anyone else again after keeping this distance. And that could even change human behavior as such.
Yeah. But I think whenever schools open, pre-vaccine, post-vaccine, we are going to expect certain mature behavior from, the children who are coming in. Your SMS abbreviation is lovely. I'm going to use it. I mean, we will see, kids in school with masks, teachers with masks. I've seen a couple of videos where teachers have conducted classes behind a plastic screen. They don't walk up to desks. They don't, answer any questions. Again, what do you think is, Dr. Dikshit, how helpful be it, to be wearing masks all the time in classrooms, for students to be having their masks on, and are any kind of mask better than the other?
That's a valid question. If you imagine schools to open, and nowadays also what we are seeing is it's very uncomfortable wearing the mask throughout the day. It's not a very comforting situation at all. And yes, we all know that there are two types of masks. One is for the healthcare worker, which is surgical mask, and it has its own criteria of wearing. Not everybody should be wearing that mask. But when it comes to the normal mask or the cloth mask, what we can talk about is the non-medical fabric mask, which can be the one which could be worn by the children and the non-healthcare worker. The protocol is one mask can be worn for at least 6 to 8 hours. Make sure that it's not wet and it's not dirty, and then you can wash it at home also. So there are certain guidelines which have been laid when it comes to the mask as well. But valid question, when it comes to the kids, I think that's a very, very discomforting situation for them, especially the younger ones. It's almost impossible for them to wear a mask and carry on their activities. So there are recommendations, instead of wearing mask, they can wear the face shield. Although that's not a foolproof idea because there are gaps between the air shield and the face. So, but at least they can carry on with the work. There is some kind of protection. But elderly or the grown-up kids can definitely wear the fabric mask. So yes, that's the mask we are talking about. Dr. Tanu can add to it further. She has been,
So, as per the Indian Academy of Pediatric guidelines, children below 5 should not wear a mask.
Okay.
Okay, because there is always the risk of getting asphyxiated, uncomfortable, dizzy,
Right.
etc. And there are also studies to show that children below 5 years actually have the highest viral loads of COVID as compared to older. So below 5, I don't think this is the time of thinking of sending them out at all. Because first, they can't wear masks, and two, they are the highest spreaders. Okay, so therefore, and then even if you look at children above the age of 5 years, compliance to mask is so poor in adults. That means if you go out in the market today, mask fatigue has set in. So while 2 months ago people were wearing masks regularly, now you see people are dropping it because they've just got fatigued. And it's so common for children that then they'll go to school, they will not be there. So it's something very, very difficult to implement, though you would want to keep telling them about it. So what we suggest is something what we tell people in offices. Some simple things. That is, first is keep the time very, very limited. So whereas the child would earlier spend 6 to 8 hours in school, now let it be 3 to 4 hours. So let it be so that they don't have to eat or drink in school, because that is the time where they actually spread the infection, when they put their masks down.
That's a great point.
Right.
So, and you have it in a different way. You have a shift system. So maybe half the students come at one time, half the others come at the other time, and you have limited time in school. You ask them not to eat or drink, etc., etc. Maybe do it 2 times a week. Make sure that and now it is well known that COVID mainly spreads in closed spaces and doesn't spread too much from contact or etc., etc. So all those things about regular decontamination and all are important, but not so much. So what is really important is social distancing and masking. So that we have to understand. And I think the biggest problem will be with the adolescents. Above 15 and 16-year-olds, because they're so rowdy, and I doubt whether they will follow these kind of guidelines.
We'll have COVID parties. COVID parties.
Yeah.
What do you think of that?
As a parent, I have to say that we are underestimating our kids.
Yeah.
I find most children so aware and so gently aware of what works for them, and we can't use these sweeping generalizations on kids anymore. They're all far more careful. I've seen more sensible kids on the road than grown-up idiots who are walking with their masks on their chins. And kids are, quite careful. They don't. They know it.
I agree with you, Mini.
That is because they're doing it for a very limited time, because they're going down to buy something, so they'll be very careful with the mask. So because we are seeing them only for limited time, but when you expect them to do it for 6 to 8 hours, whether it will be possible, that is an open question.
We come back to the same question of is it a good time to open schools? It isn't. Nothing will change. You just keep them safe. You keep, also like coming back to your original point, the healthcare system is not equipped. Look at what happened to the West when they opened the schools. They had to shut them down because there were so many COVID cases. Our healthcare system is not equipped to handle hordes of kids falling sick at the same time. That is one of the reasons we went into lockdown. I think it's just too early. We just have to now figure out how to normalize them in this situation with the hope that when we return, it will not be this, I hate using the term, but this new normal term is quite ridiculous.
So has not been discussed. Sorry, one more point is that when kids go to school, they don't only just get COVID, they get flu and they get other infections also.
Yeah.
So then the number of visits with the parents will have to make to hospitals to get these kids treated is going to be more, and then the chances of them contracting COVID from the hospital also increase, isn't it? So you know that when you are at home, you're at least protected from the other illnesses as well, and that is a collateral benefit.
Yeah. I like Dr. Dikshit's point about masks. So, I mean, it's a takeaway from Mr. Kerawala and for me that we have to have matching masks with school uniforms, cloth masks. Maybe that will excite kids, to come to school. But even I do agree with you. Even when schools do open, I mean, we are discussing not only whether they should open, but what schools will look like eventually when they open. Schools are ecosystems. It's not only about the teachers and the kids in the building. It's the support staff. It's a simple thing like how do kids come to school? What are buses going to look like? Will school buses be safe? What are the different social, whenever you talk about social distancing in India, it's somewhat of a misnomer considering how tightly packed our society is. And it'll be interesting to see, what even like long-term psychological effects this is going to have on children. My heart goes out for kids who are just starting school, especially nursery kids, because their first introduction to formal education is a screen and, friends on a laptop.
So I have a lot of friends who had preschoolers and who were supposed to put their kids in school, and they've all taken a break saying, we'll sit this one out. Not going to be a rocket scientist by the time he's 5.
Absolutely.
And, this is not the way I want him to be introduced to, to the world that is.
Yeah.
So a lot of parents have withdrawn their kids from nursery and junior KG.
That's sensible.
And then looking for re-admission, which came to me as a surprise because we never thought in our times that we would withdraw our kid. But the situation is saying a lot about it.
Completely at cross purposes with what Indian parenting is. Indian parents, we are like, he's ahead of his year and wonderful, and we are racing ahead. It's like some sort of race to make it to the IITs and the IIMs and the Harvards of the world. But I think it's a good time for Indians to learn 2 things. One is social distancing. You cannot come and stick your, butt out into somebody else just because he's ahead of you in line. So I think it's great to learn hygiene, social distancing. And the second thing is go easy on your kids. The world has a mind of its own. Where are your children racing to? What is the big hurry?
May I add one more point to it, back to basics.
Yes.
So they learn their basics. As Dr. Anjali mentioned rightly, they will learn all the basics in life, their attachment to parents, grandparents, stories hearing. That's a big connect we have now, which we never bothered to do earlier, probably. Now, that connect has come
to cook. Okay, look at the positive side of them staying in home. Kids will learn life skills. They're learning to cook, to make their own bed. Okay, they're asking their mothers, are you tired? How was your day? I'm just saying it's a good time for them to have connected with their parents. I hope to have this kind of time to teach them anything. I finally taught my daughter how to cycle. Finally. I never had time for that. She never had time for it. So these are wonderful things. Sit and talk to them. I think that's better education than anything else your school can give on.
I like what you said about even back to basic, even in terms of sharing spaces, just being able to share a space is, it's an attitude, it's not only a skill, but it's the ability to be able to do that. Mr. Kerawala, have you had withdrawals at your school for parents asking, especially at entry level, to defer admissions or take gap years?
Yeah, definitely there have been, no doubt about that. And all that I would say is that there is no harm in that.
Absolutely.
There's absolutely no harm in that, but one needs to recognize that up to the age of 5, up to the age of 6, those are the formative years. And as long as you are keeping the kids engaged, positively engaged, and with a mindset of developing the skills that they need to develop, giving them that opportunity at home, I don't see any harm. And there are enough websites, there are enough online tools that guide the parents how to ensure the child makes the best out of those situations. And yeah, so it's not just school, and it's a great time, as everybody's mentioned, to bond with the parents also. And there's, I think, enough that can be done at home, and the child can be made to do at home to develop the skills required at that age.
Ashita, can I ask a question to Dr. Kerawala and maybe to even you? How even at our school, there were efforts being made to lessen the blocks of the classes, to make them shorter, so that your continuous on-screen focus is reduced. Have longer breaks in the middle. I'm sure we can arrive at a better online system because we know that this might run on for another 6 months, of how to assess. Of how to keep these pockets for children who are, like Dr. Chhabra said, anxious. Make therapy mandatory once a week, maybe an hour with your counselor. You schedule that so that you talk about it and know that you're not alone. I want to know if schools are thinking like that. If we are to go online for a much longer time than we have anticipated. Are we going to make changes? Are we going to be as exacting on performance and on learning as we have been so far?
What I would like to say about this is that, this is all very new for us, like it is for everybody in the world. When we were asked to go online in April, it was more about getting the tech up and running, making sure people are connected, people are logging in, logging out. It was, the other stuff. When we started the school year, and many schools have started as late as July and August this year, I think a lot of focus was on schedules, like you rightly said, blocks, making sure kids have, the right balance with screen time, away from screen time. I know a lot of schools are investing in our building curriculum around synchronous and asynchronous learning. So it could be teachers or recording videos and sending them, especially, to the younger kids. Many of you pointed out, and I'm sure Anjali is seeing that too, is now really the focus is shifting to mental health discussions. Because, like you rightly said about your own daughter, you can see the nerves fraying at this, stage, not only for children, but even for adults. I mean, there are so many of us, like you rightly, you said at the beginning, maybe it's, a lot of it comes out of privilege, who are saying, I can't wait to get the hell out of here. There's mask fatigue setting in, there are elements of everything. I think the very definition of education has changed. It's no longer about assessments. I mean, world over, and I hope that happens in in India too. I can say this for universities, they are making SATs optional. They don't want kids to take exams. They don't care about your grades, because honestly, at this time, these things are not important. And I think schools are realizing it. As parents, we have to realize it. As a community, we have to realize it. That, if all of us get out of this with our sanity intact, happy, we've learned some skill, we are better people, I think that's a lot to ask for. And really, that's what, we wish for our children. But, please.
I would like to add to what Vinny is saying, and I would love to help you guys with, prepare something for emotional health, because it's not only India, it is world over that we are going to see lots and lots of emotional health concerns, and I think we should be proactive. Whether it is peers reaching out to each other, whether it's peer counselors, whether it is teachers having one-on-one sessions. I mean, it could be, once in a week that you're reaching out to a child, whether it is counselors talking about skills, and just chatting with them and saying, okay, what's happening to you? What are you going through? Because still nobody asks you, you're not going to tell. And we need to educate and help our kids to cope emotionally. Because, I mean, what is the biggest learning from COVID? Like today somebody said that, happy Teachers Day to COVID. Nobody's taught us as much as COVID has.
True, absolutely.
So, and what has COVID taught us is that the calmer you are, the more relaxed you are, the more you're going to be able to, of course, people have had all their riches, just go away, in a few days.
Yeah.
Okay, people have lost family members and not been able to get a closure to that. You see a parent being taken away to the hospital and that's all. And he's dead, you know. So there's been so many things that have happened, So I think we need to make our children partners in this, and we need to come up with creative solutions. But emotional health is the way forward, and I'm here for you guys if you ever want,
Thank you.
set up the system and to go ahead.
Thank you so much. There's an interesting question. I'm, being sensitive to the time. It's 5:16, so we have 14 minutes. So even to all the attendees, if you have any questions, please, send them. And this really is actually open to the entire panel. Is there any value to consider the option of not having formal education this year at all? Just creating spaces for children to learn, interact, not really being in a particular grade. I think a lot of the, pro open, let's open schools lobby is really mainly due to the whole emotional angle. It's not a content thing. It's a space thing. Should kids be in, not in a classroom, but in a space where they feel, safe to learn and interact? So let's challenge the notion of, a classroom. But I would really like to end this webinar by us trying to create what a school will look like when it does open, because it will open. So let's move away from the discussion about whether we should open schools, when schools should open, but what will schools look like when they open? Because they're going to be now more than just classrooms. Any thoughts on that?
So, if I can.
Please.
So I think my understanding is, rather than looking at schools, we need to look at education and the education sector per se. And I think that is going to be much different in the way education is going to be conceived. It's not going to be driven by schools and individual institutes in that sense. There will be a lot of virtual education that will happen with schools just serving a part of it. So that's the way I look at the future, and I think that's a great thing. I from an education sector perspective, because had it not been for COVID, looking at things differently. And especially, I think the context is for the schools in the urban areas, but specifically even in the rural areas. I think, in spite of the digital divide and I think
Can you please come closer to the mic, sir?
this particular pandemic,
Much better. Thank you.
this particular pandemic took a long way in evolving the entire education system, which will be in the long run far better. I agree with you that it's come all of a sudden, it's been new, but hats off to the teachers who adapted to it. And the system is evolving every single day. There's new learnings every single day. And I think the entire system and the teachers are adapting to it, whether it's trying to figure out what are the social needs, what are the emotional needs of the students, and how do you identify that online. So the challenge is they haven't done that before, but I think they are getting there. Slowly, step by step, they are getting there. It will be a collective effort, including the parents. That are
Maybe if I were to tell you that school opens on the 1st of Jan, what would you expect to see in place?
1st of Jan will give me enough time to first figure, assuming that the numbers are reducing, and I'm assuming that 1st of Jan would be a logical time to open schools. I would say definitely masks, sanitizers, no shared meals. Just get that vaccine already. Yeah, I would say regular sanitization. See, my biggest worry for schools, Ashita, is that we just discussed closed spaces. Okay, schools, especially urban schools in Bombay, they are all air conditioned. They are towered up. I mean, Dr. Kerawala would know. They're all buildings, so they're all air conditioned. Those are closed spaces. I would have to say that I would prefer the batch system where you have smaller batches of students coming in, doing their one-on-ones, direct, teacher-student contact, going back home, doing their assignments, coming back in, a stipulated period of time. I don't think even by Jan, I would expect you guys to do a regular, 750 to 250 kind of a school situation. It would be tough. It would be tough. We would be at the edge of another breakthrough. I mean, the doctors would be able to say it, but not comfortable. I think right off this academic year, teach your children whatever you can. We're all trying hard. Teach them life skills. Go easy on them. This is very tough. It's time for. I think it's the parents who should actually stand up and be parents. Take the toughest rap on their knuckles and say, we are going to keep our patience with the kids, anxious kids. Be there for them. This is where you stand up to being a parent. Yeah, इसलिए तो बच्चे हैं. When you're the adults. Next year, you tell me that you're starting the academic year from 2021. I'm good. Till then, I'm not sending my kids.
Why not have classes on the beach and in gardens?
That's what I said. Bombay doesn't have that privilege.
No, we have.
उनके लिए शुरू करो. And in fact, can I please say something in this forum, because I know a lot of concerned parents are watching. If anyone has extra iPads, has extra computers that they're not using, they've upgraded their equipment. There are enough people who are collecting them to give them to rural children who don't have enough access to it. So let's all be a little careful and dig out everything that we have in terms of laptops and iPads, and make sure they reach the right hands so that a little more of us can have the privilege of online education. But having said that, rural schools I feel can open faster because they'll be like out in the open, on the beach, under a tree.
Well ventilated.
Yeah.
What would you say, Dr. Tannu, Dr. Dikshit, in terms of what are, if schools do open, other than the standard, social distancing, masks, sanitization, shorter school hours, no meals on campus, will those protocols suffice from a risk assessment point of view?
So, one thing which I would like to say is that the only thing which is certain is that it's uncertain, because everything is changing. So you may make a plan today and you may decide, but it can go anyway. So one thing which is very important is that everybody will have to be very flexible. And it is also possible that schools may open and they may have to shut down in no time. Because something may happen, you may have an outbreak, and that's already happening in the US. The number of cases have risen. So mentally we have to be prepared for very uncertain times. Also, somebody said about the vaccine, we don't even know whether, firstly, how efficacious will the vaccine be and whom will it be available to, and what is the long-term impact of the vaccine. So I think at this time we will have to make our plans thinking that this is not coming in soon for us. So I really agree with Minnie when she says that, we have to be open-minded we have to look at what the pandemic, what opportunity it has given us. We can probably think of some kind of staggered opening in the next year, but mentally we should also be prepared that whatever can be done online should be done online. So basically, the school should be only for, a little bit of what is really essential, like practicals. So when I ask my daughter that, what do you miss in online school? She says, I'm not having science practical. So, so that is it. And one more thing which I might want to say is that the risk actually, if you go out once or you go out 3 times or 4 times, is more or less the same. I mean, even if somebody ventures out of their house, let's say once a week, they have to be prepared that that may be the time where they can get infected.
Yeah.
I also say that it may be the other way around. In sometimes 6 months a year, I mean, it may just go away. So then you may be back where you thought you would be like in a normal. So I think we all have to learn with uncertainty.
That's true. I'm going to, in fact, run a poll. Should schools open this academic year? Let's see what our listeners have to say. But, listening to our discussion, it seems like there should be a new position in organizations. It should be CPOs, the Chief Pandemic Officer. I think that's a title which is now going to be as important as the CFO or, the CEO. I think, Dr. Tanu rightly said something which kind of, set the tone for our discussion, is that eventually opening schools is really a risk-benefit analysis. I think that's the way we need to look at it. The benefits of opening school are very clear. Even what Dr. Anjali said about, that whole, the emotional connect. It's about teachers interacting with kids. I mean, for example, I've been a teacher for a significant period of my life. I would have not been able to pick up on a student's emotional well-being if that child was not physically present. Like I said, there's a huge, benefit to peer-to-peer learning. What you learn outside the classroom, during lunch times, on the field, there's a huge benefit to it. But really, what are the risks? And when will we be comfortable? When will parents really be comfortable? Sending their children to school. It's not only about schools opening, but kids coming in. I don't know whether you can see the survey results. It was a very simple question: should schools open this academic year? 16% said yes, and 83%. It's not adding up, but I guess it's a rounding off thing. Are saying no. So there's, I guess, a huge sentiment out there about, the fact that we should not open schools. It's not a legislation thing. I think it's more of, comfort, confidence, and, and I like the fact that we spend a lot of our discussion talking about, the fact that your child is not in school doesn't mean learning is not happening. It's just happening in a different way, and it's looking very different today. Again, I would like to take, this opportunity to thank all the teachers who have really, Mr. Keraval already mentioned, who've gone above and beyond what they were expected to do. Adapt to a time which we thought was maybe 5-10 years away. They had to do it in a couple of weeks. Many of them are, struggling with their own kids being at home, with their spouses being at home, with a mother-in-law who is happy to have a daughter-in-law at home who can, help out in the kitchen. There are so many different, socio-economic, facets to, not only learning at home, but even teaching from home. So really, teachers have been put in the front line, as all the doctors, so many of you have been. So thank you to them, and thank you, to all of you for taking the time out on a Saturday. It's 1.5 hours of a discussion that we kept going.
And thank you, Ashita. You brought up so many points and put everything together in such a coherent thought that I've learned so much from you today. So thank you for moderating the session.
No, thank
Thank
you.
you.
Very, very gracious of you to say that. And have to thank, the team at Suburban Diagnostics. You can't see them, Vineet and Abba, they are, behind the scenes. So thank you very much. It's been glitch-free. And really, before you logged on, I said, tech is the new traffic. We can't help it. We are usually stuck in tech problems rather than, traffic.
The amount we have learned in this lockdown, how to, I need a kid around me. If there's no kid around me, I take my puppies also. Because I think they're going to support me through this tech.
Yeah.
And always have a backup laptop. This is the moral of the story.
You need your kids around to fix your tech.
Right.
Obviously. That's all the more reason they should be at home when you're at home.
Of course, indeed.
Yeah, and I think it's a wonderful initiative by Suburban Diagnostics to put a spotlight on different industries in different weeks. I did catch the entertainment one a couple of weeks ago, and it's sometimes we are expected to be crystal ball gazers and try to see what's going to come, but like you rightly said, the only thing certain is how uncertain things are. So let's keep our hope, spirits, and our mindsets going, and thank you very much.
Thank you. Bye.
Have a good weekend.
Bye.
Bye-bye. Thank you, listeners. Bye-bye.
Bye.